A question I get a lot from patients is, can I do this too much or can I do too many? And the answer is absolutely yes. They're asking usually with the under the scenario of repeated movement testing at home, where I'm asking them to do a movement every couple hours, but it also applies to other musculoskeletal diagnosing and therapy. For example, if we're loading your tendon every couple or 3 or 4 times per day, but you do it 8 times per day, that could be too much. It might become inflamed and irritable and set us back a few days. So it's not just repeated movement testing or repeated movement treatments that you can do too much, but it's other musculoskeletal interventions that you can do too much. The Tufts lacrosse players a few weeks ago got rhabdomyolysis because they did too much strength training, right? You can do too much for almost anything, like drink too much water or take too much magnesium, but in a skilled practitioner or clinician's hands, those risks are minimized as much as they can be. When people ask me that, can I do too many lumbar extensions? Can I do too much ankle dorsiflexion? Can I do too much cervical flexion? The answer is that I give is always yes, but I give them criteria for when to stop the repeated movement if they notice that their symptoms are getting worse. In the past, I often asked people to look for mechanical changes, but I've really stopped doing that. I overestimated people's ability to kind of understand this system very quickly. So I go by symptom response, and I tell people, if you notice there's a clear relationship between this one movement we added to your life and symptoms, please stop the movement. That's again an argument for why, for most patients, I'm only giving them one movement at a time to do, because it helps us understand what's going on. At its core, again, we're trying to diagnose first before we treat. And if you don't understand what's going on, then you don't have a diagnosis. So if we add just one variable to the patient's life, then we can assess changes in the patient's presentation based on that one movement, if they did it at the frequency that was necessary to make an effect, to have an effect. So yes, you can do too many of those things. It's often telling us that we have the wrong load or the wrong direction or the wrong body part, but that information is what we actually need. Again, if I have a patient doing cervical retraction and their neck pain gets worse, that's telling me data that's important for my decision making about diagnosis, location, direction, and force of movement. All of those parameters that we need to understand about the patient's presentation and the patient's problem. If retraction makes someone's neck pain worse, then that informs where we go next. So this idea of doing too many mostly applies if it's the wrong exercise. If it's the right exercise, there's a very slim chance that you can do too many because your body needs it. So if your body needs repeated wrist flexion, and I ask you to do 10 every couple hours, and you do 20 every hour, and you get better, then it probably means that's the right direction, and that's therefore why you can't do too many. You could also have that same scenario where you do a lot more than prescribed, and there's no effect. But if it's a worsening effect, then the answer is like, well, yes, you did too many. So that's also kind of like the description I give to patients. It's like, yes, you can do too many, but that's in the case of this being wrong. And don't worry about it being wrong. Think about it as a test, meaning I need to know what happens to your neck when you do cervical retraction, because there's nothing that tells me what your neck needs, if it needs retraction or extension or flexion or protrusion or lateral movement, unless we actually do the test. The baselines, the verbal history, any images you may have had in the past do not tell me how your neck responds when we do a lot of retraction. There are 3 options when your neck does a lot of retraction. Either signs and symptoms improve, there's no effect, or signs and symptoms worsen. I'm likely looking for, in many cases, or in almost all cases, for things that will have a fruitful, positive impact on the presentation. There are some times where I'm looking to rule out things and I may do things that could possibly be provocative, but those are very few and far between in terms of scenarios with patients compared to this scenario, which is I want to know what retraction does to you. And if it's not positive, well, now we have the information to know that we need to look at left side bend, or we need to look at protrusion, because there's nothing that I would have known from the beginning without what happened to you with retraction that I could have made a better decision. I needed to know that retraction makes you worse for me to look at protrusion, for example. So I know that's kind of a long-winded way of saying it, but yes, you can do too many, but it's not just repeated movement testing that carries that risk. You can do too much tendon loading. You can do too much strength training, right? You could probably do too much stretching. You wouldn't want to put a lot of stretch on a nerve that's entrapped, for example. You would want to be very cautious with that. So it's just a slightly different paradigm for a lot of patients to understand, because I think the frequency is so high to begin with, about 10 every 2 hours, that it kind of scares a lot of people that, oh, can I do too many? The answer is yes, but if we follow the rules regarding symptom changes, we're not going to get ourselves into too much of a bind, and we'll gather data that we need to inform clinical decision making, not only regarding treatment, but backing up regarding the diagnosis.